Welcome back, everybody, and here we are in the next series of the webinar. What is it? Navigating My Aged Care. Today we're looking at registering to My Aged Care and different aspects about it. So we've looked at the actual My Aged Care website. We're now going to be talking about the call centre and the wonderful work that they're doing there to assist us in actually registering. This is proudly brought to you today by OPAM, which is the Older Persons Advocacy Network, and I'm Marie Montgomery, your host. I'd like to acknowledge again COTA, the great work in the Navigators Trial funded by the Australian Government. Let's pop up the journey board because we are at step 2, still at step 2, and this is all about registering with My Aged Care. And even today, as we sit here and discuss it, I feel that there'll be many, many different levels to this, so that we may never get to 6, but we'll get there. Together we will get there, so thank you for that. Along the way, our advice on this journey has been to be prepared, research this journey, have an understanding of what your aged care is going to look like, and age positively. All too frequently and sadly, we here find that we observe older Australians in crisis. They are unwell, they are vulnerable, and they are struggling then with the first time accessing My Aged Care. We recommend highly that you sit down and discuss ageing with your family and friends, and I guess have your finances, your will, your power of attorney and everything organised and ready to rock. So let's come now to the amazing panel I have. So I have Alison McCann here. Welcome back.
Thank you very much.
Yes, so Alison is the Assistant Secretary for Aged Care Access Branch of the Department of Health. Maria Berry is next, the beautiful Maria Berry.
Hi again.
Our consumer health representative and also our aged care consultant. And finally, the young, a very handsome young gentleman down the end, John Watson. Welcome, John. Here, now this is a great title, My Aged Care Contact Centre Service Manager.
Yep.
That's fantastic. And thank you so much for being with us. Sorry, with Health Direct Australia.
Thank you for having me.
Yeah, look, we really appreciate your time. So again, up in the right-hand corner is a Q&A little toggle button. I always get the IT stuff wrong. Please send us your a Q&A and we will answer it. And I've got one from the last session that we need to address very shortly. There is no captioning. That's the other one I meant to say earlier. We're unfortunately unable to caption the live streaming. However, we can at some stage rectify that. There's a Facebook group. Please join. We love to share. It's just up on the page now. Go to groups, go to navigating, and you'll find the group. We will copy the links in and look at some of the discussions that we've had here today. So we'll follow up on that. And we're getting a bit of a group together, so that's brilliant. Alrighty. So I'm going to go with your... Oh, actually, I'll just do this question that we had through in the last session, which was talking about the My Aged Care website. And we asked anyone out there who'd used the website for any feedback. And I have to say, Alison, this one's for you. Janet calls and said the new website is a huge improvement.
Well, that's fantastic feedback, and of course I'm very pleased to hear that, and thank you very much, Janet.
Yeah. So anyone else out there, please talk about the call centre and the website and any other questions that you have for us today. So, over to John. Tell us a little bit about yourself. What's your role? What are you passionate about? All those sorts of things.
Yeah, so I'm the service manager for the My Aged Care Contact Centre, and I've got over 10 years worth of experience working in customer service environments and looking at customer journeys.
Yeah,
And I guess
sorry.
And I guess I'm really passionate about my role because I've worked in aged care both in Australia and the UK.
Okay.
So I appreciate how far a little bit of assistance goes to prolong someone's independence.
Yeah. And John, that's so important, and you're right. Sometimes it's just a little bit of assistance.
Yeah.
They can stay at home, they can enjoy their life.
It goes a long way.
Does, absolutely. Great. Thank you. Maria?
Maria. Yeah. I've been involved as working with older people for over 30 years now, both professionally, and I've also been the daughter of aging parents navigating the healthcare system. And it was a challenge for myself back then to try and do that. So I really welcome aboard all this work and what's coming with My Aged Care. So
Right.
thank you.
Thanks for being here. Alison.
Oh, thank you, and fantastic to be invited along to your webinar series.
Pleasure.
So my role in the Department of Health, the Commonwealth Department of Health, is to manage the gateway to My Aged Care. So
Okay.
that's the contact centre, the website, and the records that underpin that. So I'm absolutely passionate about being able to continue to improve the My Aged Care system. It is a good system now, but there's always room for improvement.
Yeah.
And I'm very interested in hearing people's feedback. So whether it be about the website, the contact centre, or their experience in general,
Mhm.
we'll stay in touch,
Mhm.
and I'd be very happy for that information to be passed on, and that will help us with future enhancements as well.
Great, excellent. And you're right. Look, we all need to reflect and acknowledge and take feedback on board to improve services and delivery. Excellent. So I'm going to concentrate mainly today across with yourself, John. So today is about the call centre and what actually happens when we actually call. And we've had a lot of input from viewers about, well, we haven't picked up the phone because we're not sure what we need to do. And they may have not had internet access, so they may not have seen the website.
Yeah.
So do you want to just sort of chat about that for a bit?
Yep, absolutely. So we recognise that some people are uncertain about the My Aged Care journey.
Mm-hmm.
At the My Aged Care Contact Centre, we acknowledge that sometimes we're the first person, or the agent is the first person that they've talked about
Okay.
how they look to get help. So we tried to make the process as easy as possible. We've got around 400 agents based in Australia
Great.
who are ready to take the call. They're all certified in aged care. They're not clinically trained.
Okay.
They're able to answer any questions that you have about the general My Aged Care journey and to provide that information so that the client can make an informed decision.
Right, and it's, again, that meets the Charter of Rights. It's about informed decision making about your aged care services, etc. So that's brilliant. Very good. So I guess when they ring, what sort of things do you need to have by the phone when you're actually ringing? What sort of practical things do we sort of talk about there?
Yeah, so some people might call us for the first time just to try and understand what it is exactly that we do.
Okay.
And we can provide them information about the My Aged Care journey and what that looks like and what that entails. And some people may have already researched that and through the website, the new website,
Yeah.
and they may be ready to start their journey on that first call.
Mhm.
So if that is the case, we recommend that the person has their details ready. That can include their Medicare information.
Okay, so Medicare card, yeah.
Medicare card, yeah. And also, if they've decided that they actually want a representative to help them through the journey,
Mm-hmm.
we would recommend that they have them with them when they call,
Okay.
so that we can obtain consent from both the representative and the client to ensure that that person can actually speak on the client's behalf and help them navigate the My Aged Care journey.
Beautiful. So Tom's actually just popped up the site that's on the My Aged Care website
Yeah.
about representatives and who can be my representative and how do I appoint them.
Yeah.
So that information is excellent that it's there beforehand.
Yeah.
Do you recommend having a representative on that first point of call?
So that is part of the conversation that we have when we take someone through the My Aged Care journey for the first time.
Mm-hmm.
We ask them the question if they would like to have a representative, and we also talk about the benefits of having a representative.
Okay.
It's not mandatory, it is a personal choice.
Yeah.
But at any point during the client's My Aged Care journey, they can appoint a representative, and
Okay.
absolutely anybody can be a representative. We just need the client's consent to add them to the record. And from there, they can talk to us about the client's circumstances and speak on the client's behalf if needed.
Okay. Excellent. Good. And I'm just going to do a little plug there for advocacy services as well, because they could also be a representative, or at least assist with that representative process.
Yep.
Yeah, beautiful, excellent.
Marie, in relation to representative arrangements, some of the feedback that I received directly from the clients using the system
Yeah.
is they assume because they have representative or similar arrangements set up with other government departments that will transfer across to My Aged Care. Unfortunately, at the moment, that's not the case.
Okay.
We are working towards more joined up services, but for you to access representative arrangements for my aged care purposes, you do need to specifically set it up for
Okay.
this purpose.
Again, that comes back to, I guess, having that discussion about your aging and what preferences you have and who you'd like to have assist you. So planning and being, I guess, aware. Always good. Yeah, beautiful. Thank you for that. Alrighty. So, Maria, you were going to discuss something anecdotal about representation.
I guess just to stress how important it is that you have that representation in my professional role, and even as a role as a carer, as a daughter.
Yeah.
Things hit crisis point, and without that representation, you can't be that voice for a person. You can't take away their right to choose and refuse.
Mm.
I had a situation where a carer went into hospital. The daughter rang beside herself. Her father had a cognitive impairment, and he said, "No, I don't want to have anyone speak for me, and I have the right to refuse." So
Yeah.
that's one example.
Okay. So I'm just going to bring this quick question in from Kim, if I may, before we go any further. I am my mother-in-law's power of attorney. How do I gain access to her information on my aged care site?
Yep.
So I just think while we're talking about representation.
Yeah, it's a very good question, because we also ensure that people who have got legal representation can actually speak on a client's behalf as well. So on the My Aged Care website, we do have the appointed representative form, and that just needs to be filled out with the accompanying evidence sent to us, and then we can reflect that on the client's record, and that person will then be able to speak on the client's behalf moving forward.
Beautiful. Excellent. See, this is great. The Q&A is live. We can answer the questions, and they're concerns also that a lot of people are probably having or thinking about. So thank you again for that, Kim. Quickly, one from Nina, and then we'll move on. Will there be able to have access to our slides after the webinar? And I'm assuming it's the journey map, Nina, and that's on our OPAN site. So it's opan.com.au, and go to navigate, and you'll find the journey map there for you. Excellent. Good. So we're now at the call centre, and the call's coming through, and we've discussed you need your Medicare card and a few of the questions that they will ask and sort of the background of that particular person. So what does somebody need to do to really get started in this journey?
Yeah, so once we've explained what My Aged Care can do and how to access government subsidised services, we will ask if the person wants to start their aged care journey.
Okay.
And in order to do that, they need an aged care record.
Okay.
So we'll give their consent to create a record in the system, and to do that, we'll need to collect some personal information, such as the name, the address, the date of birth, their contact information.
Mm-hmm.
And once we've done that, then we can move to the second part of the call, which is really just a conversation about the person's ability in their own home, their life and health style questions.
Mm-hmm.
And we'll be looking to understand what it is that the person needs help with, and also what it is that they can and cannot do, and any special needs or considerations that they need us to take into consideration throughout their My Aged Care journey.
Okay, so what would be an example of special needs that you may need to take notice of?
So we try not to define what a special need is. We like to give that to the person, and whatever they come back with and inform us, we like to record that on their aged care record to ensure that where possible it is taken into consideration through their My Aged Care journey. And it just really depends from one person to the other what they consider important.
Yep.
Some people may have special needs and considerations that they just don't want to share with us because it simply doesn't impact their ability to manage their own circumstances.
Yeah.
But then some other people may consider other information important, and we can include that on their record to ensure that throughout their My Aged Care journey it is taken into consideration.
Fantastic. Thanks, John. Thanks. Alrighty. So the phone call itself, how long does, if we again look at those practicalities, how long does that sort of take?
So the phone call from creating the record and then asking those questions usually takes between 10 and 15 minutes.
Okay.
So it's not too long.
Yeah.
And the questions are, again, really just about what that person can and cannot do. But if the person has any questions about anything that we're asking or any information that we've provided, we're more than happy to go into as much detail as possible to ensure that the person knows what is going to be coming next in their journey.
Great. Now, you said you create a record, and I believe it's called a referral code, or I guess an account number, is it?
So you've just touched on quite a common question.
Okay, good.
So when we create a record in the system, that person is given a unique reference number. It starts with AC. So AC.
Okay.
Yeah. So that is their unique code in the
Uh-huh.
system, and that allows us just to find their record a lot quicker when they go back. But also there is another type of code that's commonly provided through the contact center, or we get calls about it quite regularly, and that's a referral code. And that code is specific to a type of service that the client has been approved for once they've met with an assessor.
Okay, so your referral code would change with different services?
Yep.
Okay, but your AC number,
It's always the same.
right, specific to you.
Yeah.
Right, so that gives clarity to many of the questions that we've had come through.
Yeah, so is the AC number what some people refer to as the My Aged Care record number?
Yes, that's the one. Yeah.
Right.
So when you call the contact center, you may be asked for your record number or your AC number, as it's often referred to,
Uh-huh,
or your My Aged Care record number,
okay.
and then that will just give us access to the record quickly. But it's okay if the person doesn't know that number, because we can search using their personal information.
Right, because I was just about to say, I lose my passport. Not my passport, but my passwords a lot, and I struggle. So I was just wondering, oh my gosh, this AC number, what if I forget it or I can't find it? Again, we're in crisis, we've fallen over, we need to access stuff. Suddenly we can't find all this stuff.
So it's usually included on the top of any letters that My Aged Care send out.
Uh-huh.
So it's easily accessible that way. But like I say, if the person doesn't have that number, then we can just search on their personal information.
Fantastic, good, thank you.
It'll be on their record in the portal as well.
It is, yeah.
All right. Now, in regards to the centre itself, what times, would you be open?
So the contact centre is open from 8 till 8, Monday to Friday local time. And then we're also open on Saturdays as well from 10 a.m. till 2 p.m. local time.
Great. That's a pretty good service, isn't it?
But if anyone's got questions when we're out of hours,
Yep.
They can go through the My Aged Care website, as we touched on before. There is a contact us section there.
Yeah.
People can send feedback and questions, and we will respond to those as well.
Excellent. Good. All right, let's move on to some barriers to gaining entry, because it is a call centre, and although the national phone lines are better than national internet services, but there are still, because we had a Q&A in the last session as well about hearing impairment. So what sort of, processes do you have in place to assist someone that does have a hearing impairment or some other form of impairment to register with the call line?
Absolutely. So as we touched on earlier, if that person has got a representative who they would like to manage their My Aged Care journey, they can give us a call on the client's behalf. But if the client would like to manage their own journey, we do have processes and other services in place that allow us to speak with people who may not be able to communicate over the phone. So we've got translation services.
Yes.
We've also got the National Relay service as well.
Okay, good. So in the next webinar, we actually will be looking at, the National Interpreter Service and how to access them.
Yep.
There's a video that we may look at as well in regards to how to get the 3-line going for the interpreter service. And there's also the site up there for yourselves, the myagedcare.gov.au website. Excellent. So the actual number for the call centre, that's something we haven't chatted about. What's that?
It's 1-800-200-422.
Beautiful. So 1-800-200-422. And look, when I do these webinars, I always forget numbers, John. So
I wonder whether we might just go back to the website as well, because
yeah.
when you look at the
Alison's
website,
driving today.
if you go to the Contact Us link, either up the top or down the bottom, that will also give you that number, because if you're like me, you can't remember numbers.
Yes.
All that information is there.
Ah.
So the contact number, the times that it's open, and the sorts, if you need help calling, the sorts of support that
Yeah, the National Relay Service is mentioned on there.
So tell me more about the National Relay Service. What exactly is that?
So it's a service that allows people who can't communicate over the phone
Mm-hmm.
to actually type their message through a website,
Yep.
and then that service relays it back to the MyHK Contact Centre.
That's fantastic. So, I mean, any way that we can make this service available is what we need to investigate. And you seem to be doing a great job there.
Yeah, so the link's on the MyHK website, and it's a seamless.
Oh, there it is
process.
there. Beautiful. See how quickly that comes up when I don't even type in. Fantastic. Okay, yeah, I can see where that is now. Beautiful. Good. All right. So we've talked about some of the barriers and I guess the journey. What sort of, and I know we hadn't really discussed this, but what sort of time frame between that first initial little discussion to what happens then? We put down the phone. What happens?
So once we've went through the series of lifestyle questions and we understand the person's circumstances,
Yeah.
there will be a recommendation through the system which suggests an assessment type.
Mhm.
So what we'll do is we'll gain the client's consent to send that information to an assessment organisation in their local area,
Mm-hmm.
and the assessment organisation then makes an appointment with the client to do the face-to-face assessment in their own home.
Okay.
So we pass that information through our system, and the time frame for an assessment typically is around 4 weeks.
Okay.
But that does vary depending on locations in Australia and the priority of that referral to the assessment organisation.
Yes.
But if the client has any concerns or questions about timeframes or how long they've been waiting for an assessment, they can always call the MyHK Contact Centre and we can help.
Or get onto the website as well and see. Can you at that stage, in that stage between that first phone call and then getting, is it a letter that you get with your AC number?
No, we provide the AC number over the phone when we
Okay.
register the client. Yeah.
Okay, so then they could get onto the MyHK website and check their portal. Would that
Yes,
be correct?
absolutely. You could go onto your portal, you could see that you've now registered,
Yeah.
and that an assessment referral has been made,
Mm-hmm.
and you'll be able to see what the next step will be, which is connection to services as well.
Well, and see that in itself, that little step by step that we've just done, just shows how it will. You are able to follow through what where you're at.
And there will be general confusion throughout the MyHK journey. Sometimes it's easy
Yeah.
to replace.
Yes.
And if someone doesn't have access to the portal, for example,
Mhm.
the MyHK Contact Centre is always available to answer any questions about what's going to happen next or where something is up to.
Okay. Great. Well, yeah. Go.
I'm still driving, sorry. Well, one of the earlier conversations we had was about one of the barriers being not everyone has access to technology, and so
Yeah.
the website isn't an option for everybody.
Yeah.
We absolutely understand that, and the contact centre can help with all of the information that is also accessible on the website. So if, for instance, you wanted to find out about service providers in your local area, they can access that information for you, print it out, and send it to you. They can send you brochures, they can send you a range of publications that will help assist you or whoever you're caring for to understand the services available.
Mm. Excellent. And while we're on that, the OPAN website, all of these webinars will be stored there as an educational suite. So if you are navigating My Aged Care, you can go over these over and over. So look, you can have a community little morning tea and watch us. I think I should have a morning show. All right, so we've got some questions coming through. So let's have a look at these. Sarah, the conversation time is all well and good, but what about waiting times on hold for someone to pick up?
So typically our calls are answered very quickly in under a minute.
Yeah.
There will be times throughout the day which are peak times where that might be a little bit longer.
So is that a peak time in the evening or?
Yeah, so it'll be in the mornings,
Uh-huh.
at lunchtime, and in the
Uh-huh.
evenings.
Yeah.
So we are open till 8 o'clock.
Yeah.
We're also open on Saturdays as well.
Okay.
So we do acknowledge that there sometimes is a wait time, but typically we do answer calls within under a minute.
Okay. Thanks, Sarah. Okay. This is Janet. I was helping a person understanding the call and was on speakerphone so I could help out, but I was asked to turn off the speakerphone by the agent.
So usually that is the case because the sound quality on the agent's end is quite bad and they
Okay.
actually can't hear the call.
Okay.
We do allow for people to speak on a client's behalf.
Uh-huh.
We just need to make sure that that person has consent to be speaking on a client's behalf.
Yeah, okay. That's fair. Yeah. Good question though, Janet, because these are the logistics that people are having. Okay, Kim, what happens if someone has had an assessment and is eligible for services by local providers, however there's no capacity to provide these services? So that actually, Kim, is a really big question, and we are probably going beyond what we're doing here today. We are going to have a big session on those sorts of questions coming up, and I will address this, Kim. But it is just something, unfortunately, with remote as well and rural Australia, sometimes those services just aren't in place. That's a huge question that many places, services will need to get together and hash out. But we will address that at some stage through our journey. Okay, one more from Sarah. Oh no, that came through twice. I don't know why, Sarah, but I've got you twice. Sarah. All right, so let's get back here. Maria, do you have anything anecdotal to do your journey of my aged care with the call centre, or have you helped someone onto the call centre that you'd like to ask John?
Sure.
Share.
I think in my previous roles and professional roles, I've always, if anyone has rang me, I have always referred them on to my aged care and really put it out there about getting a representative, because even though the situation might be okay at home now, it's when you hit that crisis point, and also realising that the person on the end of the phone is really quite traumatised and very emotional.
Yeah.
And so the more preparation that you can do, I just can't, promote that enough. And the fact that we just don't know what's around the corner and what could happen, and unfortunately it changes, but it changes very quickly. And my aged care, I mean, they can't provide the information or help unless you have given consent.
Yeah.
And it's
Having that conversation.
Absolutely.
Yeah.
So I can't stress that enough.
Yeah.
We don't want the My Aged Care Contact Centre to be a barrier to accessing aged care services.
Okay, yep.
But it is quite a common scenario where we find that clients don't have a representative in place and their circumstances change, and their friends and family understandably want to help. But in order to obtain information specific to that client, we need to have them as a representative on the record. So it is encouraged to add a representative as early as possible, even if that representative is not necessarily needed at that point in time, to ensure that if your situation does change, that we can continue to speak with your family.
Yeah. Well, my sister Ali, if you're out there, you're my representative. Okay, we got that.
It's on here.
It's on here. It's recorded. Beautiful. So, John, what else would you like to share? We've got a few minutes left, or a minute. What are your parting words for today?
I think it's important to know that the My Aged Care Contact Centre is always there to help.
Yeah.
We want to remove the stigma of accessing services or the unknown.
Yes.
And the first call to My Aged Care doesn't necessarily mean that we have to create a record in the system or that we have to go through questions about your health and lifestyle. We just really need to understand what is making you look into aged care. And we can send publications like Alison touched on before, and we can refer to the website as well if the person has access to it, so that they can obtain this information themselves and educate themselves before the services are actually required. But also importantly, if services are required, we can actually put the person on that journey to access subsidised services.
Yeah. Okay, that's fantastic, and I agree with you. You know that getting in and getting the, I guess, having awareness. It just is going to help. All right, now I've got a question here. I'm sorry, Tom, I'm having some difficulties. Question from Lorraine, just on the last thing. A person is not able to register online. Will this ever change? And if it does, will a representative be able to do so?
That's a very good question.
Yeah.
And so the answer is we are looking at enabling that into the future. The government has invested a large amount of money through budget measures to improve my aged care in general. One of those things was the website. Another one was the consumer portal.
Yes.
And one that we're working on this year and into next year is having the ability for you to register online should you choose to do so. And it is about choice. Some people want to talk to a contact centre.
Okay.
Some people want to do their registration online. Yep. Others want to do it through their GP.
Okay. Beautiful. That was a really good question, Lorraine. Thank you so much. We are now running out of time, and I'd like to thank everyone on my panel for your amazing input today. Thank you so much for coming on our journey with My Aged Care. Now, we've got another one coming up after this. This is looking at assisting diverse groups registering with My Aged Care. Don't forget the Facebook page, and we will see you in half an hour. So again, thank you. Bye-bye.
Right.